Hey everyone, and welcome back for another deep dive. Today we are going to be tackling healthcare access in the Netherlands,
Oh, interesting.
specifically focusing on refugees.
Okay.
And we've got a ton of sources on this, news articles, personal accounts. We even dug up some raw data.
Wow.
But the picture they paint is, oh, it's complicated.
Yeah, I can imagine there's this perception of the Dutch system as like this perfect example of universal healthcare.
Right.
And in a lot of ways, it is. I mean, did you know the Netherlands has one of the highest doctor-to-patient ratios in all of Europe?
Really?
Yeah, we're talking 42.4 doctors for every 10,000 people.
Wow, that's a lot.
Way more than a lot of their neighbors.
Okay, so that sounds great, but I'm sensing a but coming, and I'm guessing it's not just about how many doctors they have.
Exactly. The system looks good on paper, but when we look at how it actually works for people, especially those who are new to the country or struggling financially, that's where the cracks start to show.
Gotcha. So let's talk about those cracks. A lot of our sources point to super long wait times, especially for anything that's not an emergency.
Yeah.
There's even an article about a cancer patient down south who had to wait months for treatment.
It's unfortunately pretty common. The average wait time for a specialist appointment can be like 6 to 12 weeks, sometimes even longer, depending on what you need and where you are.
Seriously.
And if you compare that to other European countries with similar healthcare systems, it's a pretty stark difference.
So it's not just a one-off thing. These delays are like built into the system.
Yeah, and that can have some serious consequences.
Right. And it's not just specialized care either.
Yeah.
What about ambulance services?
That's another big issue. A bunch of our sources talk about a shortage of ambulances, especially in rural areas.
Oh, wow. So people are waiting even longer for help in emergencies.
Yeah, think about it. You're in a critical situation, every second counts, and then the ambulance is delayed.
That's terrifying.
Yeah.
There was that story from Utrecht, right? The patient who died waiting for an ambulance.
Yes, it took like 40 minutes for the ambulance to get there.
Oh my gosh.
It's just a really tragic situation, and even though the government is calling it an isolated incident, it does highlight how strained the system is, especially when it comes to emergencies.
Yeah, it's like having a fire station, but not enough trucks to respond to every call.
Right.
So we've got the doctors, but getting to them quickly,
Yeah.
particularly in emergencies, is a major obstacle. And then there's the whole financial side of things, the health insurance.
Oh, yeah, that can be a real maze.
Yeah, a lot of our sources talked about that.
Healthcare in the Netherlands isn't actually free. Everyone has to have health insurance.
Okay.
And it can be really expensive, especially for people with lower incomes.
So how does the system work exactly?
So you have your basic insurance package that covers the essentials, but it doesn't cover everything.
Right.
For things like dental or physiotherapy, you need extra insurance, and that costs more.
So it's like having a car with only basic liability insurance. You're covered for the basics, but if you need more, you got to pay extra.
Yeah, that's a good way to put it. And for people who are already struggling to make ends meet, those extra costs can be a real burden.
It seems like the system is designed to help everyone, but then money gets in the way and prevents some people from getting the care they need.
And that's where things get complicated.
Yeah, and I'd imagine it's even harder for refugees who are entitled to health insurance, but probably face a whole other set of challenges.
Absolutely. Refugees are supposed to get the same basic health insurance as Dutch citizens,
Okay.
but navigating the system can be really tough, especially if you're new to the country and don't speak the language or understand the bureaucracy.
So even though they technically have coverage, there's still roadblocks.
Yeah, it's like having a key to a door, but the door is chained and bolted shut. You might have the key, but getting through that door is a whole other story.
I'm starting to get it. It's not just about having health care. It's about being able to actually use it. It has to be affordable and easy to understand.
Exactly. And that's where the Dutch system, despite its good points, seems to be falling short.
And who are the people who are being hit the hardest by these shortcomings?
Well, those with lower incomes who can't afford the costs, those in rural areas who have to deal with longer wait times and ambulance shortages, and of course, refugees who are trying to figure out a whole new system.
So even in a system that's supposed to be universal, there are still these inequalities.
Yeah, and that's something we need to dig deeper into. Understanding these issues is essential if we want to evaluate how well any healthcare system really works, especially one that's held up as a model for others.
Okay, so we've established that the Dutch healthcare system is facing some serious challenges, even if it looks good on the surface. Long wait times, financial barriers, and the struggles of refugees are just the beginning.
And that leads us to another problem, nighttime emergency care. It's an area where the system is really vulnerable.
Nighttime emergency care, what's going on there?
Imagine this. You're seriously injured in the middle of the night and need immediate medical attention. But you don't have insurance, maybe because you just moved here or you can't afford it.
Okay, that sounds scary.
It is. Getting emergency care in that situation can be a nightmare.
Why is that?
A lot of healthcare services, especially those that help uninsured or low-income people, have limited hours.
Oh, I see.
And even if you find a place that's open, they might demand payment up front, which a lot of people can't afford.
So basically, your chances of getting timely emergency care depend on your insurance and your ability to pay on the spot.
It's a scary thought, but that's the reality for a lot of people. Your socioeconomic status can actually determine whether you get the care you need to survive. And that's where those cracks in the system become canyons.
This is heavy stuff, but we can't just ignore it.
Yeah,
We need to understand these problems so we can start thinking about solutions.
I agree. And that's what makes these deep dives so important. We're not trying to point fingers or trash the system. The goal is to understand the issues and figure out where improvements can be made.
Okay, so we've got long wait times, financial hurdles, challenges for refugees, and this whole other problem with getting emergency care at night. What's next?
I think before we jump into solutions, we should look at the bureaucratic side of things. All the red tape that people have to deal with.
Okay, let's untangle that bureaucratic mess. What are we talking about here?
It's like trying to put together a piece of furniture, but the instructions are in a language you don't understand and half the parts are missing. That's what dealing with the Dutch healthcare bureaucracy can feel like, especially if you're new to the system.
That sounds incredibly frustrating.
It is. Just applying for health insurance, understanding what it covers, finding a doctor, making appointments, figuring out your medical bills, it can be overwhelming.
Especially if you don't speak Dutch.
Exactly. And all this complexity leads to delays, miscommunications, even denials of care. We see this a lot with refugees who have to jump through hoops just to get basic medical services.
It's like having a life preserver, but it's wrapped in layers of plastic and tied with knots that you can't untie.
Perfect analogy. And these bureaucratic problems can have serious consequences. One of our sources, a refugee in Rotterdam, talked about their experience trying to get treatment for a chronic illness.
Oh yeah, I remember that one.
They had to wait months because of language barriers and problems navigating the system. It was really stressful for them.
It's awful that people are being denied or delayed care just because they can't figure out a complicated system.
It really shows that a healthcare system is only as good as its ability to reach the people who need it most. And that's where the Dutch system, even with its strengths, seems to be missing the mark.
So we've got systemic delays, financial barriers, bureaucratic nightmares, and extra challenges for refugees. It's not looking great for healthcare access in the Netherlands. But surely there are some good things about the system, right?
Of course. It's important to remember that no system is all bad. The Dutch approach to healthcare has a lot of good qualities. And that's what we'll explore in the next part of our deep dive.
Okay, so stay tuned, folks. We'll be right back after a short break to look at the brighter side of Dutch healthcare.
We spent a lot of time talking about the problems with healthcare in the Netherlands, but it's important to remember that no system is perfect. And the Dutch system actually does a lot of things well.
Okay, so let's highlight those positive aspects. What are some of the things the Dutch system gets right?
Well, for starters, the Netherlands consistently ranks high in international healthcare comparisons.
Oh, really?
Yeah. For example, the Euro Health Consumer Index, which looks at healthcare systems all across Europe, has consistently placed the Netherlands among the top performers.
Interesting.
They get high marks for patient rights and information accessibility of care and the range of services they provide.
So even with the challenges we talked about, the system still delivers good quality care.
Exactly. And one of the reasons for that is their emphasis on preventative care.
Preventative care.
The Dutch system really encourages people to get regular checkups and screenings to catch potential health issues early.
Oh, that makes sense. Yeah.
Yeah, it's like investing in regular car maintenance to avoid major problems down the line.
I like that analogy.
And beyond preventative measures, the Dutch system is also known for being innovative in how they deliver healthcare.
In what way?
They've been pioneers in things like e-health and telemedicine, using technology to improve access to care, especially for people in remote areas.
So they're using technology to overcome some of those accessibility gaps.
Exactly. And they also put a lot of emphasis on mental health care.
Okay.
The Netherlands has a very well-developed mental health care system that's integrated with their general health care.
That's good to hear.
Yeah, it means seeking help for mental health is encouraged and seen as normal, which helps reduce stigma and improves access to support services.
That's a really important point, especially with the growing awareness of mental health issues around the world.
Absolutely. And of course, there's that high doctor-to-patient ratio we mentioned earlier.
Right.
While that doesn't magically solve all the problems, it does mean there are more doctors available to serve the population.
Right. But as we said, it's not just about the number of doctors. It's about being able to see those doctors when you need to and being able to afford it.
Exactly. And that's why these conversations about reforms are so crucial.
Right, because even though the Dutch system has its strengths, they also have weaknesses that prevent some people from benefiting equally.
Exactly.
So let's talk about those reforms. What kind of changes are people proposing to improve healthcare access in the Netherlands?
A lot of the proposals focus on tackling those key problems we've talked about.
Okay, like what?
For example, some people want to streamline the bureaucracy so it's easier for everyone, especially refugees, to understand and use the system.
Okay.
This could mean making the insurance application process easier, providing information in different languages, and giving more personalized support.
So basically removing all those unnecessary roadblocks.
Exactly. And on the financial side, there are ideas to increase subsidies for people with low incomes to help them pay for insurance.
Okay.
Some people are even pushing for a sliding scale payment system where what you pay depends on how much you earn.
That seems fair.
Mhm.
Everyone would be able to afford healthcare no matter their income.
Exactly. And to address the problem of long wait times, some proposals suggest increasing the number of healthcare professionals, especially in areas where there aren't enough.
Like rural areas.
Right. This could mean offering incentives for doctors to move to rural communities or expanding training programs to get more doctors into the system.
So it's about putting resources where they're needed most.
Right. And when it comes to emergency care, especially at night, people are talking about extending the hours of clinics and hospitals that serve uninsured and low-income folks.
Makes sense.
Maybe creating more 24/7 facilities or even mobile healthcare units that can reach people in remote areas.
That's a really cool idea. Bringing healthcare to the people.
Exactly. It's about recognizing that access to healthcare is a basic right, not a privilege for those who can afford it or figure out a complicated system.
And these reforms, if they actually happen, could really make a difference in creating a more fair and equitable system for everyone.
They definitely could. But we have to remember that reform takes time. It's an ongoing process that requires continuous evaluation, adaptation, and a willingness to learn from both successes and failures.
It's not about finding the perfect solution, but about constantly improving, striving for a system that works for everyone.
Exactly. And that brings us to another important point, the role of the individual in all of this.
What do you...
Each of us has a responsibility to speak up for a healthcare system that's fair and just.
So it's not just about government policies and system changes, it's about individual actions as well.
Exactly. We can all stay informed about healthcare issues, have conversations like this one, support organizations that are working to improve access to care, and hold our elected officials accountable for their decisions about healthcare policy.
So it's about being active participants in the system, not just passive recipients.
Exactly. And that's the real power of these deep dives. It's not just about learning information, it's about starting conversations, inspiring action, and empowering people to create change.
Okay, so after all this, what are the key takeaways for someone who's navigating the Dutch healthcare system?
Well, I think the most important thing to remember is that even though the Dutch system has its flaws, it also has strengths. So be informed, be proactive, and don't give up on getting the care you need.
So don't be afraid to ask questions. Speak up for yourself and seek help if you need it.
Exactly. And remember that there are resources out there to help you. Reach out to patient advocacy groups, community health centers, or even your local government for guidance and support.
And what about refugees who are new to the Netherlands? What advice would you give them?
Don't be discouraged by the complexity of the system. You have a right to health care, and there are organizations that are dedicated to helping you access that right.
Yep.
Find those organizations, connect with other refugees who have been through the system, and don't hesitate to ask for help.
So it's about building a support network, finding people who can help you navigate and advocate for your needs.
Exactly. And remember, the Dutch healthcare system is always evolving. Reforms are being discussed, changes are happening, and your voice, your experiences, and your advocacy can make a difference in shaping a system that works for everyone.
That's a powerful message. So we've explored both the good and the bad sides of healthcare access in the Netherlands. We've looked at the system's strengths and weaknesses, talked about proposed reforms, and highlighted the importance of individual advocacy.
And hopefully we've given our listeners a better understanding of this complicated landscape and empowered them to navigate the system and contribute to its evolution.
Now, as we wrap up, I want to leave our listeners with one final thought. We've talked about a lot, from those long wait times to how the Dutch system is using technology in new ways. But what really sticks with me are those personal stories we heard, the real impact these problems have on people.
I agree. Those stories really put a human face on this whole conversation. It's easy to get lost in the statistics and policies, but those personal experiences remind us why access to good healthcare is so important.
Absolutely. And one thing that stood out to me was how much refugees struggle to navigate the system. They seem to face a unique set of challenges.
Definitely. Imagine coming to a new country, maybe escaping a war or persecution, and then having to figure out this complicated and confusing healthcare system. It's a lot to handle, and it really shows how much more support is needed for refugees.
Yeah, I keep thinking about that story from Rotterdam, the refugee who waited months for treatment. It's a reminder that having a health insurance card doesn't guarantee access to care.
Right. You also need to understand your rights, know how to navigate the system, and feel comfortable advocating for yourself.
So what can be done to better support refugees and make sure they have equal access to healthcare?
Well, a lot of the reforms we discussed would help, especially those that simplify the bureaucracy and provide information in multiple languages. But there's also a role for community-based initiatives.
Oh, interesting. So not just top-down solutions, but also grassroots efforts.
Exactly. Things like organizations that offer language support or cultural mediation services, or even just informal networks of refugees helping each other out, those can make a big difference in bridging the gap between policy and real life.
It's powerful to think about community-driven solutions working alongside those bigger systemic changes. It shows how important collaboration is in tackling these complex issues.
It really does. And at the end of the day, I think creating a fairer healthcare system starts with recognizing that we're all connected. When we understand that everyone's health impacts the community as a whole, we're more likely to support policies and practices that benefit everyone.
It's like that saying, we're all in this together. If one part of the boat sinks, we all go down.
Exactly. It emphasizes the importance of working together and sharing responsibility for a healthcare system that reflects our values.
So as we wrap up this deep dive into healthcare access in the Netherlands, what's the one message you want our listeners to take away?
I would say healthcare is a fundamental human right, and everyone has a responsibility to ensure equal access. Stay informed, stay engaged, advocate for yourself and others, and remember that your voice matters in creating a fairer and more compassionate system.
It's a call to action, reminding us that we all have a role to play in building a healthier and more equitable future.
Exactly. The journey towards a more just and compassionate system is never truly over. It requires all of us to be involved, informed, and willing to push for something better.
Well said. And on that note, I think we've come to the end of our deep dive. We've explored the ins and outs of healthcare access in the Netherlands, uncovered some hard truths, but also highlighted examples of resilience and innovation.
I hope we've sparked some important questions about what a truly equitable healthcare system should look like, both in the Netherlands and beyond.
To our listeners, we leave you with this. What role will you play in shaping the future of healthcare? What actions will you take to make sure everyone has the opportunity to live a healthy and fulfilling life?
It's a question worth thinking about. Until next time, keep learning, keep questioning, and keep striving for a better world.
And that's a wrap. Thanks for joining us on the Deep Dive.